In this presentation, we will discuss different products available to help overcome oral hygiene care challenges, as well as treatment recommendations for oral health conditions. One product we can use for oral health care in persons with dementia is a power toothbrush, which can be really helpful. The problem is that some people with dementia will find the vibration and/or noises of power toothbrushes disturbing, annoying, or scary. Another product you can use is a toothbrush that bends in different directions. You can also bend a regular toothbrush under warm water. Toothbrushes bent 45 degrees may be used to pull the person's cheeks out, as you can see in the center right picture, facilitating the use of a second toothbrush to access the person's back teeth. When people start presenting with swallowing problems, it is essential to continue oral hygiene care and to keep the teeth and soft tissues clean. Keeping the mouth clean is very important in preventing aspiration pneumonia. You can brush the teeth without toothpaste or only with water. There are different bite blocks and mouth props you can use, some of which have suction devices. There are also toothbrushes with suction devices. Additionally, chlorhexidine rinses can be prescribed as a chemical adjuvant by a dentist or medical practitioner. They are known to reduce dental plaque accumulation levels. Some products will not work as desired. Basically, cosmetic products that you can buy in a supermarket will not be very helpful and do not have any significant therapeutic effect. There is, however, enough evidence to support some products that really work. Although there are not many clinical trials involving persons with dementia, some products have proven to be safe and effective. High fluoride prescription toothpastes, which have 5 times as much fluoride as regular fluoridated toothpastes, are particularly useful and should be started in persons with dementia as soon as possible. Other products, such as MI paste, can also be used to increase the efficacy of the fluoride and reduce the sensation of dry mouth. Chlorhexidine rinses are also important to reduce plaque levels, but should not be used concomitantly with fluoride products. For those who are still able to chew, sugar-free chewing gum is a good way to stimulate saliva production. Saliva substitutes can also help reduce dry mouth. For poorly retentive dentures, denture adhesives can be helpful. There are many ways to help people presenting with dry mouth. An inexpensive way is to use drinking water in spray bottles and have the bottles available all the time. Sometimes it is possible to change medications for similar ones with less of a dry mouth side effect, though this is not always possible depending on the medical conditions that are being treated. Saliva substitutes can also be used, and there are many available on the market. Saliva substitutes presenting as gels will usually keep the mouth moist longer as compared to liquid products. Sialagogue medications, such as pilocarpine, can also be used, provided that adverse effects can be monitored on an individual basis. It is also important to avoid toothpaste with additives, lemon and glycerin swabs, and mouth rinses that contain alcohol. Regarding angular cheilitis, it is important to clean the affected skin with antibacterial soap, apply Nystatin cream several times a day, and keep the lips lubricated with lanolin or KY jelly. Be sure to keep good records of the medication regimen. Regarding denture stomatitis, it is very important to brush and disinfect dentures and denture containers. The slide provides suggestions of possible disinfection procedures, such as using sodium hypochlorite or benzalkonium chloride, or microwaving. However, it is important to consult a dentist on the preferred way to disinfect an individual's denture, as there are many different denture materials currently available on the market, and each will have its own best way to get disinfected. Usual denture cleaners, although generally safe for different denture materials, are of limited therapeutic use for treating denture stomatitis. If there is fungal infection associated with the denture stomatitis, The slide also offers suggestions of possible therapeutic measures, including nystatin, ketoconazole, and clotrimazole. However, it is best to consult with a dentist to figure out the best therapeutic approach. The most effective way to reduce bleeding gums, plaque accumulation, and periodontal diseases is by brushing the teeth regularly and efficiently, as well as having regular cleanings provided by the oral health care team. Many times, brushing and cleanings are not as frequent or efficient for persons with dementia, so prescription chlorhexidine rinses can also be used to help reduce these oral health problems. In this slide, other ways of treating oropharyngeal candidiasis are presented in more detail. However, consulting with a dentist is the best way to figure out the most effective treatment for each patient. In oral mucositis, it is very important to regularly remove heavy nasal and oral secretions. In addition, dentures may need to be removed and the diet changed to one of softer foods. Hydrogen peroxide products should not be used, nor should pineapple and other juices, as these can have a detrimental effect on the oral mucosa and increase the risk for infections. Good products to use for managing oral mucositis are an alkaline saline solution of 1/2 teaspoon of salt and 1/2 teaspoon of baking soda in 8 ounces of water. Chlorhexidine rinses without alcohol can be used to reduce plaque accumulation. The use of magical mouth rinses is not advised for an extended period of time, but they can be used in the acute phases of oral mucositis in order to reduce pain and discomfort. For reducing decay, it is essential to reduce sugar intake and frequency of exposure. That is, avoid snacking multiple times a day on sugary foods. It is also important to brush the teeth regularly and efficiently, address dry mouth, remove partial dentures, and increase fluoride exposure. Chlorhexidine and casein derivatives, such as MI paste, can be used as adjuvants. Spray bottles can be used to manage dry mouth and to spray chlorhexidine into a person's mouth. As mentioned previously, chlorhexidine and fluorides should not be used concomitantly. So when both products are necessary, chlorhexidine should be used in the morning and fluoride in the evening.